Hello, everybody. I'd just like to wish you all a happy new year and thank you for tuning in to our latest Ask the Leaders Facebook Live Q&A. I'm Keith Aspden, I'm the leader of the council, and I also chair the city's Outbreak Management Advisory Board. Today, I'm really pleased to be joined by a range of experts on this call from the council's public health team, Nimbuscare and local businesses. As with our previous Facebook Live sessions, we'll do our very best to answer your questions, those sent in advance and those sent during the Facebook Live, but with a particular focus tonight on the recent changes to public health guidance, the vaccine rollout, and the current situation in York. And before I go on and let each panel member introduce themselves, I'd like to take the chance once again to thank all residents and businesses who continue to play their part in keeping our city safe and open. Earlier in mid-December, we marked a very special anniversary of sorts, a year since the first vaccine was delivered in York, when it was announced that we had delivered 500,000 jabs in the city. And I'm sure everybody would like to thank David and his team and many others from health and volunteers for that achievement. And as of the 2nd of January, over 112,000 people in York had their booster jab. And if you are yet to book or attend many of the city's vaccine sites to get your jab or your booster, please do so as soon as possible. There is no doubt that the success of the vaccination programme is down to that hard work and dedication, as just mentioned, of the healthcare teams and volunteers involved in that historic rollout programme, the huge effort of NHS staff, GPs, volunteers, pharmacies over the last year and throughout the festive period has been exceptional. And I'd just like to thank every single person involved in the delivery of that programme, as well as all residents who have played their part and received their vaccine. All of our ongoing efforts are designed to save lives, so we should continue to follow that guidance and take the simple steps to protect each other, so to not let the sacrifices of the last 2 years go to waste. With the pandemic very much still present, as a council, we'll continue all that we can do to support communities and businesses throughout the year. And I know that is very much needed as we start 2022. And so starting the year on a positive note, by following that guidance and taking those simple measures, we'll be able to keep each other and others safe. This way, we can protect the NHS, support local businesses, and support children and young people as they are starting school this year. I'll stop on that and I will ask the panel to go around and introduce themselves. And Andrew, you're first up.
Thank you very much. Yeah, my name is Andrew Lowson. I'm the Executive Director at the York BID, which is Business Improvement District. And we represent around about 1,000 businesses inside the city centre, mostly retail and hospitality, but also professional services.
Thanks, Andrew. Carol.
Hello, I'm Councillor Cllr Runciman. I'm the Executive Member for Health and Adult Social Care, and I'm Chair of the City's Health and Wellbeing Board.
Thank you very much. David.
Hello, I'm David Hartley. I'm a GP in York. I've been a GP in York since 1996 and prior to that in North Yorkshire. And I'm a director of the Nimbus Healthcare Group, an organisation run by all the York practices who are running the mass vaccination site for you all.
Thank you, David. And Sharon.
Good evening, everyone. I'm Sharon Stoltz, Director of Public Health.
Thank you all for your time. So for those of you that haven't watched one of our Facebook Live Q&As before, as I mentioned at the start, we have some of those wider conversation topics that we're going to concentrate on today. But we've also received questions in advance from residents. And please don't forget, you can ask questions and comment throughout using Facebook. And as well as answering as many questions as we can live on the call, I know colleagues from the council will also be answering you on Facebook, both during this call and afterwards as well, if you are watching the recorded version. So one of the main areas of focus that I said we'd concentrate on today is around the current guidance for testing, self-isolation, and also support with childcare. And we've grouped some of these questions together. So the first few questions, and I'm going to ask Sharon to kick off and answer. But similarly, if anybody else wants to join in, please do. The first question that came in was, what is the current guidance around testing for children and young people? Sharon.
Sorry, should know how to unmute myself by now, shouldn't I, after all this time? Thank you, Councillor Aspden. I thought I would start, if that's okay, by just kind of giving viewers a general position of where we are in relation to COVID at the moment, and then come on to young people in particular, if that's okay. Anybody watching will not be at all surprised that our case numbers, our infection rates from COVID in York are increasing. So there's a time lag always with the test results coming through. But the most recent data we have, which is for test results up to the 2nd of this month, so the 2nd of January, show that we have a case rate of around 1,665 cases per 100,000. So to put that in context, that means that we've had just over 3,500 new cases of COVID in the 7 days up to the 2nd of the month. We've never had a case rate that high before, so we're kind of into new territory as far as the pandemic is concerned. The good thing, though, the silver lining in that, is that for the majority of people who are getting infected with COVID at the moment, they're not getting seriously ill. And they may have mild symptoms, or they may have very unpleasant symptoms, but for the vast majority of people, they're not getting seriously ill, and so we're not seeing very high hospital admissions. So the number of COVID patients we have in hospital now is nowhere near as high as the number of people we had in hospital at this time last year. So that's a positive. The negative side then of so many people in the city having COVID at the moment is the impact that it's having across all of our services. So I know businesses, for example, Andrew will know more about this, but businesses are struggling with staff off sick, either off sick with COVID, or they're having to self-isolate as a contact of a positive case. And we're also seeing that impact on the hospital, on GP practices, police, fire, ambulance services, council services as well. What we have got, though, to reassure you, is that all public sector services have mitigation measures in place and business continuity measures in place, and we're working as hard as we can and doing everything we can, working together to support each other so that essential services across the city can continue to be provided. What that does mean, though, is that people may have to wait a little bit longer to be seen if their problem is a routine one, while we divert our resources to deal with more urgent cases. But just to reassure anybody watching, we are continuing to work together as a city, as we have done throughout the pandemic, to ensure that essential services are continuing. In relation to young people, then, coming to the question, the current guidance around testing for young people is that children under 5 should not be routinely tested. And I know there's a confusion about this because I get questions regularly about this. But children, healthy children under 5, or children under 5 who are contacts of a positive case, should not be routinely tested with a lateral flow test. If a child under 5 is ill or develops symptoms of COVID, then they should go and get a PCR test. But if you're a parent who is routinely being asked by an early years provider or anyone else to regularly test your child under 5, I'll be very happy if you let me know about that, because children under 5 should not be routinely tested. For children between 5 and 18 years, what we are encouraging those children to do is follow the guidance that you've been given by your school. So schools have got particular measures in place, including regular lateral flow testing, so that schools remain a safe place for our children to be. So follow the guidance that you've been given by your school around that. If a child over 5 is identified as a contact of somebody who's a positive case, then we are recommending that those children have a lateral flow test every day for 7 days, so that they can continue to attend their school or college. That's the guidance for young people, and that's the same whether they are fully vaccinated or not. If parents are concerned about testing at all, obviously GPs are very busy at the moment, so if you have any general questions, you can come through to the public health team and we can provide you with advice around that, so that you're not having to try and get through to your GP practice. I'm sure the communications team will put the contact address for public health in the chat, but it's quite simple. It's inquiries.publichealth@york.gov.uk. Thank you.
Thank you very much for that, Sharon. Obviously the issue of testing has been quite a hot topic in both the national and local media, with the availability of tests as well. I don't know whether you'd want to give any advice to people, but also in particular, what's the council's responsibility versus where nationally some of those issues lie?
Okay, yes, I can do that. So the government, as people will know, has set up the NHS Test and Trace service, and as part of that national service, there are different routes for lateral flow tests we're talking about here, so symptom-free tests. There are different routes for those tests to be delivered, if you like. So businesses, those businesses that are registered with a national scheme, order their tests and have them delivered directly to them. And listeners may be aware that there was a government announcement just a little while ago that there were 100 businesses that were going to be identified, that were going to receive lateral flow tests directly. So that's nothing to do with the council. That's an agreement between those businesses and NHS Test and Trace. Schools then have their own ordering system for lateral flow tests with the Department of Education. So they order their tests and those tests get delivered directly to the schools. The hospital has their own system for ordering tests. And then the council's responsibility for lateral flow testing is really to ensure that there's a supply of tests for residents that require testing. We have to submit our proposals for community testing to the government, including the number of lateral flow tests we think we're going to need, and then they get delivered to us. However, the council also has a responsibility to support the wider testing infrastructure across the city. And this is what we're trying very hard to do at the moment. So where there is a shortage of lateral flow tests, we're trying to work with partners across the city to deploy our testing resource across the whole of the city responsibly. And so what residents will see, that if test supplies start to run, if our stocks start to run very low, then people may present to one of our test sites. They may be offered a test if they need one, but we'll restrict the number of tests they can take away with them to do home testing. So that we're working very hard to ensure that no one in the city goes without a test if they need one. But I'm just asking residents to be a little bit patient and understanding. If you turn up at one of our test sites and perhaps you're expecting to go away with a number of boxes of tests that you might have experienced previously, you might find that we're having to restrict the number of boxes of tests that we can give you. Hopefully this is a short-term measure. We know that there's been a delay with orders coming through to local authorities and community pharmacies, etc., because of the Christmas and New Year holiday. And indeed, our own order was delayed as a result of the holiday. So hopefully this shortage is short-term, and it will be resolved as soon as those deliveries come through. But my final comment, Councillor Aspden, if I may, is just to ask people not to stockpile. If you need a test, you can have one, but if we have people ordering more than they need, then obviously that may cause shortages for others. So it's just for people to be very sensible, really, and just to accept the fact that we're working as hard as we can to make sure that everybody who needs a test gets one. But people just need to be a little bit patient.
Thank you very much for that. And another question that came in advance was, what are the latest changes regarding testing requirements to return back to work?
So it's a legal requirement still to self-isolate for 10 days if you have tested positive for COVID on a PCR test. There are two bits of guidance that has changed recently. One is that you can be released from self-isolation early, after 7 days, provided you take a lateral flow test on day 6 of your isolation period and day 7. If those two lateral flow tests are negative, then you can be released from self-isolation early. If those lateral flow tests are positive, then you need to continue to isolate for 10 days. The other change that is being introduced from Monday next week is that if you have a positive lateral flow test, but you don't have symptoms of COVID, you no longer need to arrange a follow-up PCR test. You can take the lateral flow test as a positive diagnosis of COVID, and you don't need to arrange a PCR. That's if you don't have symptoms. The exception to that rule is anyone who needs to claim the £500 government social isolation grant. So if you are in financial difficulties, you want to claim that £500 from the government, you still need to have a PCR test. So those are the main changes.
Thank you very much. And it follows on from that point, I think, around what support is available. We received quite a lot of questions in advance about this. So I was going to ask Carol to pick up that question of what financial support is available for those who have to self-isolate, which I think follows on nicely from Sharon.
Yes, it does. Thank you, Keith. I think the important thing is that there's help for those who are on low incomes who are working, and there's also help for those who are not. And the most important thing for those who are working on low incomes, who've tested positive or who've had to self-isolate because of a contact with somebody who is positive, is that there is a £500 test and trace support payment. But of course, you must make sure that you have been told to self-isolate, and then you have to make sure that you claim that payment. For those that in financial hardship who are not eligible for that self-isolation grant, we do have a financial assistance scheme in the council. And we've got money from the COVID Management Outbreak Fund, which we have earmarked for that purpose. And you can find information about that on financial assistance scheme on our website, or you could ring the council and ask, and somebody will tell you if you're eligible for that. We don't want to see anybody struggling, but you need to tell us and we will help you whenever we can. And as Councillor Aspden has said earlier, we will get funding out to people as quickly as we can so they don't get into difficulties.
Thank you very much, Carol. And I'm sure, like Sharon said earlier, as we go along on Facebook Live, our team will include links to some of those schemes on the Facebook Live. So links to York's financial assistance scheme, and also the contact details of the public health team, so that you can follow up any of the bits of information from this call as well. Our next big topic, and one that we received a lot of questions in advance, will be of no surprise around vaccines. And I imagine that David and Sharon, between them, will take an awful lot of these questions. The first one was, how has vaccine take-up been in York? And Sharon, I know you were going to say something, but I thought I'd come to you, David, as well on this one before we start on the questions about vaccines. Sharon.
Yes, thank you, Keith. So, a huge effort really has taken place to offer COVID vaccination to everybody who is eligible in York, and obviously that work is continuing. But the most recent data I have, bearing in mind that this changes on a daily basis as more people come forward to be vaccinated, but the most recent data shows that 88% of eligible adults have had their first dose of the COVID vaccine. 84% have had their second dose, and around 64% of eligible adults have come forward for their booster vaccination. So that's really positive. And we've also have around 60% of our 12 to 15-year-olds now who have had their first vaccination as well. So we're doing really well, but obviously there's still further to go. And David, I'm sure will be able to explain to residents how they can come forward for a vaccine if they're eligible, if they haven't already done so. It's an evergreen offer. It's an offer that never closes. So if you've not come forward to be vaccinated for whatever reason, it is never too late to come forward.
Thank you, David.
Yes, thanks, Sharon. To reiterate a little bit of what the other panelists have said, I have to take my hat off to all the staff over this last 3 weeks since the Prime Minister's announcement. We've done over 50,000 vaccinations in York in that period of time. The MassVac site that many of you might be aware of normally ticks around at about 1,500 to 2,000 a day. Through this last few weeks, we've been doing 4,500 patients a day. It's doubled it, and we've had other sites around York, and we've peaked at 6,500 vaccinations given in one day in York. That is a phenomenal achievement, and I hope you'll all raise a glass to the staff who have worked their cotton socks off to do this. The figures that Sharon gave us are fantastic. The worrying bit is that means that there's still 10 to 12% of eligible people who have not had a vaccination. Today, the heads of hospitals were talking on the news and were pointing out that if you look at intensive care bed admissions, 60% of those patients are unvaccinated. 10% of the population not vaccinated, 60% of intensive care beds occupied by unvaccinated people. I would urge you to come and get it. And we are open for business, very definitely. How do you request a vaccination? You have 4 different routes. You can go through 119. You can do it online on the NHS systems. You can ask your practices. Back at my practice, I have a member of staff employed full-time dealing with requests from patients to get them slotted in. If all else fails, roll up. We will do our best to accommodate you. We will do our best to make sure that people don't get turned away from the MassVac site. We do urge you to book because that helps us with flow through of patients, and it will help reduce large queues. And in these inclement days like we have today, it's not very pleasant standing outside for half an hour. So if you book, it helps us with the flow of patients to make sure you go through at the minimum delay.
Thank you very much for that. We had a couple of detailed questions, some of which you've picked up in the answer that you just gave, but there was one around how can I arrange a vaccination for somebody under the age of 18, and I'll add another one to it, which was how soon can I get my next vaccine after testing positive? If I could go to you both of those, David.
Yes, thanks very much there. For under 18s, the same applies as what I've just said to you. So you can book through 119 online through your practice or come to the site, or the pop-up places that we're running around York. Many of you might have been aware the big push that we had over this last few weeks. We ran pop-up sites all over York, at the university, up in Haxby, at Burnholme. Phenomenal effort, and quite a few pharmacists joined in as well to help us, which was just brilliant. So for your under 18s, use the 119, go online, contact your practice. If all else fails, come to us, and we'll do our best to accommodate. As far as when can you have a vaccination after you've had a positive COVID, by and large, it's 4 weeks. But for the under 18s, it is a bit longer in order to avoid one of the side effects that has been seen in a few people, a bit of inflammation of the heart. It's a self-limiting problem, but it's 12 weeks if you're under 18 and have had a positive COVID test.
Thank you, David. Sharon, you wanted to come back in.
Yes, it was just to add to what David has said. Some of the queries that come through to me are around the gap between the first and the second vaccination, particularly with 12 to 15-year-olds now that they're eligible for a second vaccination. So it's just to explain to any parents listening is that 12 to 15-year-olds can now book their second vaccination 2 months after they've had the first dose, but the second dose won't be given until 3 months after their first. So there's a 12-week gap, 3-month gap, but you can book it after 2 months. So it might be helpful information for any parents who were wanting to organise the booking of their child's second vaccination.
Thank you, Sharon. And another question that we got in advance was, does it matter if my vaccination doses aren't all from the same manufacturers? David, if I can go back to you.
Yes, thank you for that. No. So we very much deal with the Pfizer, AstraZeneca and Moderna vaccines, although they have changed names, which has confused me no end. And one's called Spikevax. I think that's the Pfizer, but I have to keep looking up the change of names. But basically, you aim to have the same vaccine for your first 2 jabs. So if you have Pfizer number 1, you would have Pfizer number 2, ideally, but it's not set in stone. Same if you had AstraZeneca number 1, you'd have AstraZeneca number 2, ideally, but it's not set in stone. The thing that changes with your third booster vaccination is that we predominantly give people either Pfizer or Moderna, because that's been shown in the mix to give you the best immune response. The one time I think there might be some issue about the manufacture, is I believe that some of the AstraZeneca was made in India, and I believe that some European countries were not happy accepting that if you're going to try and travel. But that's another kettle of fish altogether.
Thank you very much. And one of the questions that we had in advance, actually, you've answered, but I'll just go through it anyway, which was, where are the vaccination sites in York? And just give an opportunity to repeat that. And then I'm sure our team will add that as well to the comment section on Facebook, so that information's available, David.
Thank you. Yes, I mean, the main vaccination site in York is down at Aspden Bar next to Tesco. On Tadcaster Road. That's been there now, thank you to the council for all the help and support, since we started off in, was it 2020 or 2019? It all seems a bit of a blur now, and is still going strong. And you'll see it as a mixture of tents with teepees and big porta cabins. There is very good parking nearby, there's fantastic marshals, and there's a good bus route with the park and ride and other buses. We've done pop-ups all around York, and we're looking in January to restart some of those pop-ups in the city centre. One of the practices in the city centre, my own, which is going to give it space on Saturdays and Sundays if need be, and also at St John's. I believe there's some talk with the Minster, but I don't know whether you get a blessing with that or not.
Thank you very much. One of the other areas that was asked about before the call was, what measures can we take to help protect myself and others? And whilst we've been on Facebook Live, we've started to get some questions through, and one actually very similar to that, so from Hillary, was, with rates very high, what precautions can we take to reduce the number of cases in the city? So Sharon, if I go to you first, but I'm sure that Andrew from a business perspective, and then David as well from a health, might want to add into that some advice. Sharon.
Yeah, so there are a number of things that people can do to protect themselves and others around them, but it's not any one thing. So it's important, I think, that people see these measures as a basket of measures that they can do, not just pick out one that they think will protect them. So those are some of the things that we've already talked about. So vaccination, we know, is really important. Having a vaccination won't necessarily stop you from getting COVID. No vaccine is 100% in that respect. But as David illustrated, we know that having a vaccination will reduce the severity of your symptoms, which is really, really important. So have your vaccination when it's offered. The other measures then are things that we've been talking about throughout the pandemic, you know, the hands, face space. So hand hygiene is really important, washing our hands regularly with soap and water, or using hand sanitizer when soap and water are not available. Wearing a face mask. There are now certain venues where it's mandatory to wear a face mask, but you know, having a face mask with you and popping it on when you're in an environment where you're meeting with people that you don't normally meet is a really good idea, or particularly if you're in a poorly ventilated space. Social distancing is important. Meeting people outside, if you can, is always best. But if you're meeting indoors, trying to make sure that you've got good ventilation with, you know, windows open is important as well. And then good, what we call respiratory hygiene. So, you know, the old saying, coughs and sneezes spread diseases. So, you know, lots of us have snuffles at this time of year. So making sure that any coughs or sneezes or sniffles, they're caught in a handkerchief or a tissue. If it's a tissue, you dispose of that very quickly in the nearest bin, or put it in your pocket until you get to a bin. If you're using cloth handkerchiefs, which some people do, my husband still likes to use a cloth handkerchief, for example, it's about really keeping that in your pocket and then washing it with your washing, etc. So it's sensible advice, really. And then obviously, if you develop symptoms of COVID, or if you test positive for COVID, then isolating yourself away from others so that you don't spread the infection around is also important. And so all of those measures will have a role to play in reducing the risk of infection. So you're doing them, all of them, as often as you can in combination and together will help reduce the risk of the spread of the virus.
Thank you, Sharon. Next main topic we're going to be going on to is I'll come to you in a second, David, is around businesses and business support. But we've had a couple more questions in on Facebook responding to the conversation that we've had on testing and appointments. So I'll bring in those extra questions first, and then we'll move on to business support. But David.
Yes, as far as helping prevent spread of infection, as Sharon was saying, number one is absolutely a vaccination rate. Having your vaccinations, it makes a huge difference. But there's a good body of evidence supporting face masks now. There is a mixed uptake in the public as you're out and about. You can definitely see it. I would urge people do use them. It does make a difference. The science is there to support it. There are some wonderful videos on YouTube showing how far the droplets from your mouth go when you speak, when you shout, and when you cough. And it's quite phenomenal. If you cough, your droplets go 6, 8 meters. It's a long way.
Thanks, David. Andrew.
Yeah, I think just on that subject, I suppose, yeah, I mean, I think we're all realistic now. People have to be, confident with themselves. And going back to Sharon's point, I think, there can be lots of little ways of helping to reduce how COVID might affect you, or certainly from catching it. I think from a business point of view, I mean, I know, before Christmas, there was, I spoke to people myself who were sometimes a bit wary about coming into town, because we know, York can be very busy in the lead up to Christmas. I suppose what I'd say now is, having been in town myself, it is a quieter time of year. So if you are a little bit more nervous about actually COVID for various reasons, what I would say is that town is a lot quieter, certainly than it has been over the last few months. So some people will see that as a positive. It's not always positive for the businesses. So if you feel inclined to support, then please do. I think, again, don't be afraid to, especially if you're looking at cafes or restaurants, don't be afraid to ring up and book ahead, because that helps the restaurant sometimes, is understanding, especially with staff shortages, how many people are coming. But also, that's where you have the opportunity to maybe request for a table slightly set apart, maybe a table next to a window, going back to the ventilation point that Sharon was making. And don't be afraid to do that, because businesses want your trade. They're used to these type of questions now, and they want to make your visit as comfortable as possible. And I suppose the final thing I'd say around this as well is, most businesses now have really embraced, contactless technology. So it's probably best for you to do that anyway, because therefore you're not handling cash. I mean, even with car parks, if you've got the council car parks, you can download the Ringo app, so you don't have to worry about feeding coins into a machine. All these type of things, again, if you put them together, helps reduce the risk. And like I say, if that helps you have the confidence to come and support businesses in the city centre, then we would very much welcome that.
Thank you very much. So I just mentioned that we'd had a couple of questions come in from Facebook, so I'll go through those. I think one probably for you, Sharon, and one for David to start off with. There was a question from Leanne, which is if we don't need to do a confirmation PCR test after a lateral flow test, how will we know the data regarding positive cases? Sharon, thought I'd give that one to you.
Yeah. Interestingly, I was on a national call where this came up earlier today. When we're looking at the local picture of the pandemic, we don't just look at case rates. There are a number of sources of data we use. So there's the national data collection from the Office of National Statistics, ONS. They send test kits out to randomly selected households. So there's quite a lot of information that comes from that. We obviously can monitor the number of people that are coming to our test sites and are picking up test kits. We monitor how busy GP practices are. We also monitor how busy the hospital is. So there's lots of different sources of data that together give us the picture of what is going on with the pandemic locally. And with case numbers as high as they are and expected to go higher, case numbers on their own don't really tell us very much about how serious the pandemic is locally. And because we have large numbers of people who are catching COVID and are testing positive, but actually they're well, and they're not putting a lot of pressure on the NHS, for example, and then it's more the business continuity issues that we're concerned about through staff shortages, etc. And we can pick that information up in different ways. As a council, though, I was talking to our really excellent business intelligence team earlier today, and they are going to look at how we can start to collect the lateral flow test information, perhaps a little bit differently to we are now. But the accuracy of that information will depend on people declaring their lateral flow test results. So at the moment, we know that there's a huge underreporting. People do their lateral flow tests, they've got their results, but then they don't go into the national system to input their result. And so there's massive underreporting. So we gather all of these little bits of intelligence, we triangulate all of that information, but certainly residents can help as well by making sure that they input those lateral flow test results once they've done them.
Thank you very much, Sharon. And then the other extra question had come in from Lydia, which is that there are no local appointments for 12 to 15-year-olds for the vaccine on the NHS booking link. The nearest is Knaresborough, but that I'm aware local clinics are offering them. Don't know, David, whether you've got any comments on that?
Yes, thank you, Lydia. There are two different ways of booking into the Aspden site. One is on the national link, and yes, my own daughters at one stage saw that there was no appointments being offered, and that's something we're trying to sort out when we know that actually at the site we have spare capacity. So if you see nothing on the national link, do try your own practice. We have got, as I say, at my own practice, I have a line on the switchboard that takes you to one of our staff who is just sitting there helping booking patients on a regular basis. Or if all else fails, come down to the MassVac site. At the moment, we are running with spare capacity and we'll try and accommodate you.
Thank you very much for that. So I'm going to go on to the topic of businesses and businesses in York, although there are a couple of Facebook questions that I want to get to as well. So I might have to urge everybody to be as succinct with their answers as possible to try and make sure that we get through it all. But the first question which came in, which was how has the festive period been for businesses in the city and in the city centre in particular? And I'm going to go to Andrew on this one.
Yeah, I think yeah, I often speak in these terms of looking specifically at retail and hospitality, because about 70% of our membership is made up of that. And I mean, overall, it's been very good, and certainly better than many other cities in terms of York's performance. And I mean, funny enough, I was at a conference earlier on in December where York was being described as the poster boy or poster girl of recovery. If you looked at 2021, just because it has bounced back better than a lot of other cities, which I could go into detail that for many reasons. But I think if you're looking specifically at the Christmas period, we often look at the 7 weeks, and footfall is one of the things that we often look at to see how busy the city is. And we haven't compared to 2020 because obviously that was, a lot of the UK was in lockdown for Christmas 2020. So we often look back before COVID hit. And if you look at, compare York's footfall this Christmas compared to 2019, we're only 6% down. And, we never like to be down in any shape or form. But if I tell you that a lot of the other UK cities were about 25% down on their footfall, that shows you again what a strong Christmas York has had. I mean, unsurprisingly, that week before Christmas, when the Omicron was gaining a lot of traction in the news, unsurprisingly, I think we'll all know this from conversations with our own families. We're all a bit conscious about going out, not wanting to spoil Christmas plans. So definitely the week up to Christmas, that did affect the businesses in the city centre. Probably hospitality more than retail, because again, you'll have heard in the news about people cancelling Christmas parties. Those type of big bookings really affected your hotels, your larger restaurants. So they will have definitely felt the pinch from that. But I think retail, which has often had a hard time of it over the past few years, from what I've heard, did well, because people, again, looking at what was happening with Omicron, actually got their Christmas shopping done early. So there was even some weeks leading up to Christmas where we were even getting better footfall than 2019, which is really positive. So I think from what I've heard, overall people were happy. And the reason why Christmas trading is so important is some retail can actually take up to 30 or 40% of their annual turnover in those 7 weeks leading up to Christmas. So that's why you'll often hear it mentioned in the news, Christmas being such a key time of year. It's for that reason. Businesses really do. It makes a big difference to them.
Thank you, Andrew. And it sort of leads on there to the next question, which is what are some of the challenges facing businesses at the moment and moving forward? And then I'm going to bring Carolyn as well for a question about what support is there for businesses in the city. So if I could go to you first, Andrew, on that, what challenges at the moment?
Yeah, I mean, I think as we progress, or we've got more used to the last 2 years in COVID, I mean, sometimes this is difficult to answer in a general sense, because of course the difference in restrictions can make a big difference on different sectors. It's not the same for all businesses. I mean, the first thing I'd say is, January to March, again, if you're looking at the city centre, it's a tough time of year anyway, because people, spend a lot of money during Christmas. Tourism numbers are lower. So businesses are used to be quiet, are used to being quiet at this time of year. And that's why, again, it was so important that we had a good Christmas trading period, because hopefully then people, will be able to, squirrel away a bit of money to see them through these quieter months. And then, York tends to get busy around about spring. When I think the working from home, again, impacts certain businesses, because, with us not having as many office workers in the city, you like to see cafes, sandwich shops, delis, they're feeling the pinch at the moment. And I've noticed some of them have delayed opening for that very reason. So that's a challenge for those particular group of businesses. I mean, consumer confidence, definitely just before Christmas, was impacting some of our hotels, because again, I think a lot of us before Christmas probably thought we were heading for another lockdown, the way some of the numbers were going. And so a lot of the hotels were saying they just weren't getting any bookings for the new year. That's looking slightly better now. But again, it's something which, depending on how the health advice goes, will make a big difference. Supply chain, that's, we're hearing a lot of issues about that from businesses. A lot of them having stock issues. So, you know, this is just because, you know, manufacturing around the world has changed. It's more difficult to get hold of things. So people are trying to order in early, and actually the problems they have is they don't have stock rooms big enough to actually put some of this in. So there's actually quite a high demand on warehousing space. I think inflation, that's something which we'll have to keep an eye on in the coming weeks.
Yeah.
And I think Next, you know, the high street retailer, they announced that their new clothing range is probably going to be about 5 to 6% higher in price than this time last year. And I should think that's something that we're going to see across the board. And I mean, Sharon's already mentioned it earlier on, but, you know, staffing, that is a big issue at the moment. I suppose the only you know, slight positive in this area is I was speaking to one of the big department stores today who was, you know, talking about that issue, but because the footfall is lower, they said at least it's happening at a time of year where there isn't as many people coming in. If they were having these staffing issues in the summer, then it would be causing a lot more problems. So yes, I mean, I think, you know, lots of different challenges, but I mean, again, I'll try to finish on a positive. I think, you know, if you look overall, you know, the past 22 months that we've been living with COVID, I mean, there's no two ways about it. Businesses have had a real tough time, but York, I think, has come through. It's been resilient. Again, if you talk to many of our professional services, who I haven't talked about tonight, they've adapted to home working. Trade has been strong, and you know, a lot of them are looking forward to a positive 2022. So let's hope we can weather the current storm, as it were, and look forward to a more positive year going forward.
Thank you, Andrew. David.
Sorry, couldn't find my mute button. Yes, I mean, and in the health sector, staffing is our major issue, but it's staffing in the face of a huge increase in demand on us as well. So we are struggling with a very fatigued staff. We're carrying long-term sickness. We carry the usual long maternity and stuff. And an example from my own practice, and I'm sure that Andrew will see this with his businesses, is that you don't tend to lose one member of staff. You'll lose a pile of them in one go. And that's usually at 7:45 on the morning, and they've all got full clinics booked for that day. Last week, we were down to about a quarter of our normal nursing team because of sudden isolation, because of positive COVID tests in well people. So I beg some understanding from the public over that when we suddenly lose large numbers of staff in the same day. The demand on healthcare has gone up hugely. We looked at this in the October pre-COVID. My practice took 13,000 phone calls in the month wanting appointments. In October of last year, my practice took 24,000 phone calls in the same month of October. That's 9,000 more. We have no extra staff. In fact, probably fewer because they're so fatigued and with sickness. So we're facing a rise in demand with the same number or fewer staff.
Thank you for that, David. And one of the questions I mentioned I'd come to you, Carol, there, which is what support is out there and is expected for businesses in the city?
Throughout the pandemic, the government has allocated funding to support businesses. And one of the things that I know has happened from my visit to the hairdressers is that the City Council has got out help, monetary help for such businesses very quickly. And I have a feeling, and I know that Councillor Aspden will know this, that we were one of the best councils in getting grants out to businesses. Now there are one-off grants up to a maximum of £6,000 for businesses in hospitality and leisure, and some discretionary funding which we have. So people can apply for the grants, and we are waiting information. I'm not sure it's come to us yet as to how that will be done. But anybody who had a grant before, it's worth applying again, and you should find that there is some help and support for you. We realise that for some businesses that will be not as much as they have lost, particularly in the hospitality and leisure sector. But just to add to what Andrew was saying, it's really good to go outside in the pandemic. And if you can go and have a cup of tea or coffee and a sticky bun or a nice cake somewhere and sit outside, if it's not throwing it down with rain, that's actually quite pleasant. And there are lots of places in the city centre where they've put seating outside, and they'll be very pleased to see you.
Thank you for that, Carol. And I'm sure in our own areas, places like Fulford, Heslington and Huntington, there are many similar establishments as well that people can go to locally. And what we will make sure is that a link is put on the Facebook Live to the latest business support pages from the council. And as Carol said, as soon as we get that information from the government, we will then be in a position to make sure we are, again, one of the quickest councils to process that funding, because it needs to get to those businesses that need it now. I'm very conscious of time, as we've only got 4 minutes left before we're going to close. But one question did come up on Facebook, which I think followed Andrew, a comment about concerns that people might have around alcohol-based hand sanitizers. And I was keen just to make sure that was mentioned here. So there was a question there: is it safe for children to use, and what can residents do if they need alternative solutions such as a non-alcoholic hand sanitizer? I don't know whether Sharon, David or Andrew wanted to have a go at that one, but I'm afraid we haven't got long. Sharon.
So I'll start off then by saying that hand washing with soap and water is by far the best. If soap and water isn't available, there are a range of hand sanitizers available, alcohol and non-alcohol based. So if you go into any supermarket or in any pharmacy and look at the range of hand sanitizer that's available and check the ingredients, they don't all have alcohol in, if you would prefer to use one that is alcohol free.
Yeah, I think, I mean, just, I mean, the York bid did put a number of hand sanitizer stations around the city centre. I do believe that does have a little bit of alcohol in it. I mean, we did actually have this question over the period we've had them in there, and yes, I mean the absorption rate, you know, is nothing that neither adults or children have to worry about from what we understand. So I will relate to my medical colleagues on this, but we had chat with the manufacturers and from a health and safety point of view, so I wouldn't worry about it at all.
Thanks.
Yes, I've not seen a major issue with it, but Sharon is quite right. Hot soapy water, but you need to do it for 20 seconds. So sing happy birthday to you.
Thank you very much. One of the questions and areas that we'd hoped to cover today, but we won't have time, was around what support is available, particularly for emotional health during the pandemic, and what resources are available. But I'll make sure that we put a link on Facebook Live to those resources and help. I don't know, Carol, if you've got one sentence you'd like to say about that.
Yes, I have. Find something to do, preferably outside. If you've got a riverside walk on it. If you've got a pond, you can visit it. And go, if you can, with somebody else. You don't have to hold their hand all the way. Just walk with them. And if you've got children, even better. But do something. Don't just sit at home and feel awful about the whole situation, because it's not that bad, actually, if you can get outside and see the world.
Thank you, Carol. And we'll make sure we put some links up on Facebook Live to that support information and advice. So as I bring things to a close, I just wanted to firstly thank all of the panelists for your time. It's much appreciated. All those that submitted questions and have watched or are watching the recording afterwards. And if you do want to keep up to date with what's happening and the latest news, the council issues a variety of regular newsletters, so some in paper form directly to households, but also a number of email newsletters, so for example for residents, for businesses and for families. And if you want to sign up for any of those newsletters, we'll be including the link on Facebook, hopefully as I speak. If not, if you go to york.gov.uk, you'd be able to use the search bar to find those email updates. And that information can also be found on, as I said, the council's website, and on social media. If you still have questions that we haven't been able to answer, and or you're watching this as a recording, please do comment after we're live, because colleagues from our communications team will still be looking and will still respond to your inquiries. So I'm sure we will do another Facebook Live soon as the situation emerges. But as I did at the start, I'd just like to thank all residents, businesses, volunteers, and those from across healthcare. We've heard just a small fraction of the work and efforts that everybody's been putting in and continuing to put in January. So it's appreciated. And thank you very much for joining us today for Facebook Live. Thanks all.